And then Renee, would you mind introducing yourself to the group?
Sure. Renee Bolio Banks, Indigenous, Jaganashimang, Zibikwe Indigenous Indigo, Sagaswa Jamaica, Gandunjiba, Migizin Indudame. So my name is Renee Bolio Banks. My spirit name is River Woman. I'm from Leech Lake and the Eagle clan. I've been at NACC for about going on 6 years. I'm the elder in residence, just providing help for our relatives out there. Miigwech.
Miigwech. We'll introduce the rest of the ECHO team to start. Dr. Robbie?
Hi, my name is Kari Robbie. I'm a family practice and addiction medicine physician. I've been here at NACC since about 2012. I'm happy to be here. Thank you for coming.
And Nikki?
And I'm Nikki Jardina. I'm a public health nurse, and I've been at NACC off and on since 2017. And right now I supervise the syndemic nursing program.
And I'm Lindsay Kinkuni. I'm the harm reduction program supervisor and also the coordinator for the Midwest Tribal ECHO. So thank you for being here. I'm just gonna share my screen and we'll start with some announcements. All right, so welcome everybody to Midwest Tribal ECHO. We're very excited to welcome Sharon Day, the Executive Director of Indigenous Peoples Task Force, who will be talking to us about a presentation called What Sovereignty Got to Do with Opioids. A little bit about NACC, if you're not familiar, we're an FQHC that was established in 2003. We're a full service clinic. Listed there is everything that we have to offer. Our website is down at the bottom. So feel free to go to the website to learn more about us. These are current open positions at NACC. We have several listed here. So again, our website is at the bottom and you can go to our job section to read more about these job openings. Some session guidelines, please know protected health information. Please mute yourself if you're not speaking. We love to see your faces. I'm noticing more cameras on today. So yeah, we definitely welcome that. And then if you could let me know who you are in the chat, just your name, title, organization, and email, I can get information sent out to you if that's requested. And then this is a list of other ECHOs that cover similar topics on opioid use disorder, infectious disease, harm reduction. So feel free to contact me if you want more information about these other ECHOs. And then some announcements. So our next session will be on April 2nd, and we're welcoming back Dr. Alice Lehman, who will do a part 2 on her syphilis presentation. And then I just wanted to point out, it's National Native HIV/AIDS Awareness Day tomorrow, and Indigenous Peoples Task Force is hosting an event at the Minneapolis American Indian Center from 11 to 4 p.m. And that's just right across kind of kitty corner from us on Franklin Avenue. So we're excited for that. And then finally, for me, case presentations, if you have an example of a presentation, they make for great discussion. So my email address is listed there, and feel free to reach out if you have any ideas for us. And I think with that, I'm going to hand it over to Sharon. Thank you for being here.
Yeah, thank you, Lindsay. Bujun and Indue Magani Nagamo Mangan and Lishnakas, Wabashashin Dodam, Ojibwe Koyandao, Dishnijo Madeo, Madewana Koyandao. So greetings, my relatives. My name is Singing Wolf, and of course my English name, Jaganash name is Sharon Day, and I'm from Boyce Fort, and I'm Ojibwe, Wabashashi, Pine Martin. That's my clan, and I am also second degree Madewan, and also one of the head water women from the Three Fires Lodge. So just thank you, Lindsay, for posting our flyer for tomorrow, National Native American AIDS Awareness Day. We have a really good program lined up. our Lieutenant Governor, Peggy Flanagan, will be there. Mayor Fry will come and do some opening, and we'll have some singing, some jingle dress dancers, and you know, a few words about HIV, and you know, all those things that go along today with HIV and some of the other illnesses as well. And there'll be tables and testing and food and good food. So that's tomorrow. But today, before we get into the presentation, I had prepared this a while ago, and since then, you know, most of you, maybe many of you know already that on the news last night, they're proposing to eliminate the prevention branch of the CDC and to move, or perhaps to move it to HRSA. So we knew it was only a matter of time, right? Because, you know, once they, you know, when he immediately closed AMFAR and USAID, that even though they said they wouldn't, we knew that they would eventually go after HIV, because, you know, we've already had to scrub our website from any references to, you know, the LGBT population, the trans population, and even as far as, you know, in the Ojibwe language, we don't have any, there's no pronouns in our language. But, you know, in English, of course, there is, and a lot of staff had pronouns on their email, you know, below their name, and so asked people um, to know that you know, that's something that that this government frowns on. We are one of the only, I think we're one of two Native organizations that are directly funded by HIV. So of course this will affect us immediately whenever they make that change. There may be other programs that are funded through CDC, but those are through funds that go to the states and then are funneled to programs. But our funding comes directly from CDC, and we've been one of the only Native programs directly funded, you know, for about 25 years now. So so those are you know, so we're in for some dark days, I think, ahead as it relates to HIV, and you know, the question I thought about this morning was, you know, I think we need to ask people, you know, they immediately attacked those that are most vulnerable. And you know, at some point, we're all on the list, and so we have to ask ourselves, you know, like what can we do if we want justice? What can we do if we want peace? And you know, can there be peace without justice? So okay, so that's enough of that. But that's what's happening right now. Another disclaimer is to this particular group is, you know, I'm not a doctor. I'm not a clinician. You know, I'm a community person who, you know, worked in chemical dependency, and in 1988, you know, a couple of people came to me and said, you know, what are you going to do about AIDS? Because there were no services, and And so it was kind of time for me to get back to the community and do some work. And so that's what we've been doing since 1988. And since then we've branched out into other areas. But our main work always has been dealing with HIV and then housing and harm reduction. And we can't really have health in our communities unless we're providing service to those people who are most vulnerable. Okay, so what's sovereignty got to do with it? Lindsay, you want to go to the next slide? So one of the things we know is that we have this large disparity for addiction and in our community. And one thing about HIV is you have to do something to get it. It's not airborne like COVID. You have to do something. But still, why we have this large disparity? And of course, we all know about historical trauma, the genocide, the land theft, the forced assimilation, and the generational trauma. And we know about all these things, the adverse childhood experiences based on the boarding schools, the foster home. Yeah, and even, like if we were raised by somebody in our family, if our grandmother raised us or our auntie raised us, there's still some of those feelings of abandonment and those kind of issues, that contribute to addictions, which can lead then to HIV and all kinds of other situations. You can go to the next slide. So, we talk a lot about social determinants of health. But I think we really have to begin to focus on the politics of health determinants, because, it all began with these policies and that were targeted at us, the doctrine of discovery, which basically said that any lands that were not occupied by Christians could be taken. And, the 500 treaties that were signed, you know, for as long as the grass shall grow, and we know that every single one of them was broken. And in those treaties, it said that they would provide us with health care and education in exchange for our lands. And, another policy was war on drugs, criminalizing and drug usage. It meant that American Indians were more likely to be arrested and more likely to be convicted than white folks. And I think Shakopee is a good example where we're only 1% of the population in the state, but at Shakopee Women's Prison, 23% of the population are American Indian women. And that's, the overburden to our population of all these, the war on drugs, all of these policies is just incredible. So Politics of Health Determinants, there was a book that was written a few years ago by an African-American man. And I should have included in here, but if you look this up, you can find that book. And he talks about it, and, all of these politics. He talks about that, when they write laws, seemingly some of these laws look like they're going to help us. But the devil's in the details. And I think even, we look at our own state, some of our own state laws, and Minnesota Care, that policy it was written to help people who were underemployed receive health care. So if a person signs up for Minnesota Care, it's good for 6 months. But if they do not renew before the 6 months is up, that care is gone. And then they have to go back and reapply all over again. And so it's some of those things like that, that they look like they're a good thing, and they are, but um, but why is it only 6 months? So those kinds of things, and there's so many more like that affect our community every day. So we need to look at these policies. Um, um, uh, the Indian Child Welfare Act is another one. It was the impetus for that act came out of Minnesota because 1 out of 4 Native children in the 70s were placed outside of their home. And so, people said we got to do something about that. They wrote the Indian Child Welfare Act. And there are so many issues with that law. And today, how many Indian kids are still placed outside of their home? And it's still someplace around 25%. So, 50 years later, so we really have to really look at, laws as they're being proposed, and provide the information to improve them, because even if people are well-meaning sometimes, if it's not their experience, um, uh, they don't know. And so it's our responsibility to tell them. Okay, we can go to the next one. And so here's another one, um, the erasure of our history. It's not taught in the history books. Uh, I remember even when my grandson Joey was about 7 years old. He said, and this was after Minnesota had passed a mandate that they had to teach about Native culture. He said to me one day, he said, Graham, you know, when are they going to talk about Ojibwe people? The only thing they talk about are like the Pueblos, you know, and so they followed the mandate of the law, but they didn't talk about the people right here in this state. So there are all these ways, systematic ways. And right now, also the federal government is eliminating everything, from the code talkers to, renaming and sites, so on. So that kind of genocide, of what's written, and not providing that information to people, really can continue the genocide that continues today. Anyhow, so you can read that, and there's there if we had the accurate data, and when they're studying things, like why can't they do an oversampling of American Indians, especially when they know that we're such a small percentage of the population. A few years ago, Hennepin County did a study on the LGBT population. And so, they had a big unveiling of the information, and I went over there and I sat there for 3 hours, and there was not one word about American Indians. And so I asked them, well, why is there any information about American Indians? And they said, well, because only one person responded to the survey, was in their survey. And so their surveys, who they surveyed were only people with landlines. And, so there was no people, but why not do an oversampling? Then go to where the population is so you can have some accurate information. So there's all kinds of ways that they do this. And just a couple of years ago, we're seeing more and more of and dementia amongst our population. And so the U of M is going to do a survey and do a little bit of research. So they provided some cognitive tests to people who chose to participate. And so I took my brother, and we went over there, and I was done in about 20 minutes, and my brother was still in there after like 2 hours. And I had told them, like, try to keep him on track. And anyhow, that's neither here nor there. But then they did the blood, about a year later, they did a blood test, which they sent me all the results, which was really great. And the third phase is an MRI. And I told them I wasn't going to participate in that. But I wanted to participate to increase the amount of information there is about American Indians here. The more research they do, because things affect people differently and different racial groups, and there's not enough information to know about American Indians. But we are seeing more of that, and so I want to participate in that particular survey. And so I think, that this whole thing about genocide isn't just, giving people smallpox blankets, but, or like the syphilis, not treating people for syphilis like they did, with the black folks down in the South. But there's all kinds of ways to do that. And one of the ways is you just don't study them. Okay, let's go to the next one. So here you can see, probably everyone is aware of this, but you can see that American Indians have, a higher rate of overdose by death. This is from 2010 to 2019. Go to the next slide. And this is, 2021. Here, I think we're like 10 times more likely to die from drug overdose. And I don't have a slide here on women, but we know that American Indian women die even at higher rates than any population by racial group or gender. And let's go to the next slide. And here again, we're 1% of the population, and we have 14% of the opioid involved deaths. Next. So what can we do? Well, immediately, I think one thing to do is to the little bit of funding that we have now, we need to keep. So here, I put this slide together in December. It was, increased funding for harm reduction. We know that's not going to happen. And we need to keep the funding that we have for HIV programs. We know that there was an uptick in HIV after the encampments began, and since a wall of forgotten natives and the encampments, we know we've had more HIV. So, we need to, and we also know that, when people are using, they're more likely to catch any kind of infection, but they're also more likely to participate in behaviors that will put them more at risk for HIV. So we need to, continue these services, syringe exchange, mat services. We need to have more cultural services for treatment, housing and mental health. We did a survey last year with people who participated in our harm reduction program, as well as people who did not participate in our harm reduction program. And one of the things that they said is, they want to be with other Native people, and I think this has showed up in every survey that's been done with the unsheltered. They want to be with Native people, and and this goes back to so I'm old, and I remember Laura Waterman Woodstock. She had been the executive director of magazine until just shortly before she passed. And she did a survey for some study by Wilder Foundation back in the 70s. And they did the same thing in St. Paul. They asked some of the chronic alcoholics, native men and women, um, some questions. And what they said was, we want to be together. We want to be with other Native people. Why didn't they go to shelters? They want to be with Native people. They want to eat Native food. They want to speak the language, and they want to sing. And those are the things they said back in the 70s. And those are some of the same things that we're seeing with the unsheltered today. We can go to the next slide. So what can we do in terms of programming? So we have an internship program, and some of our interns were at NACC and other about I think we had 18 different community organizations that hosted an intern. But we take these young people, and we've had about 60 of them, and participate in a work training program, and also peer-to-peer navigation. And then they go out into the community, and they have between 20 hours a week for 2 to 3 months of a paid internship. That provides a service to the community-based organization that takes them, but it also provides work opportunity for these young people. And this has really helped not only the young people, but about 15 of them have been employed by the agencies where they did their internship, including IPTF. We have a couple of them. So these 18 to 24-year-olds who are sort of floundering out there, this is an opportunity for them to get back into the workforce, to maybe get ready to go to school, to go to college. I've done some of the groups myself with them, and asked them, like, what do you need to do? And they say things like, I need to get up off of my mom's couch. I need to deal with my depression, so I can stand on my own 2 feet. Things like that. And besides the work readiness, we have some great people on our staff, and so people like Linda Eagle Speaker, and Gio Cerise, and Suzanne Nash, they go in and they do mind, body, spirit work with them. And so that for this last group, they just went out, started their internships, and they got together on Monday afternoon, and they came in and they did a 3 hour of the mind body medicine workshop. And they were also happy, to come back together again as a group, and share. So, I believe that if we're going to get a handle on this opioid epidemic and all the other things that go along with it, is we have to yeah, do prevention. And we have to do prevention with these young people, starting in middle school. And by the time they're 18 to 24-year-olds, we're sort of like helping to rescue them, pull them out of the river, whereas what we need to do is stop them from jumping into the river in the first place. But I'm really grateful for this opportunity to have this internship program. And I can see, you can see it working, and that's great. And we can go to the next slide. So, a couple of other youth programs that we have. One is Wave and a Gay. And this is, I think it's 12 lessons of ATOD prevention that we deliver both in-school programming and after school. And this curriculum came from a women's cessation program that we did probably in 2000 or so. And then we reworked it for adolescents. I think it was the National Minority Health. Yeah, I can't remember exactly what the name was, but they gave us money to rework it for youth, and it worked. We knew that it worked for women from the we did uh, uh, follow-up surveys with them at 3 months, 6 months, 9 months, and I think it was 18 months. And we knew from that the program worked. So we reworked it and developed it for adolescents. And so this program has been very successful. The Ikitawin, which was formerly the Gichida Gikinomagi Youth Theater program, is based on peer education. And this was the first program that I created when I came to the task force. And, it really is about reinforcing somebody's identity and introducing cultural teachings to them. Our kids come in, most of them don't know how to introduce themselves in their language. Many times, these we're talking about third, fourth generation living in the city, and when they come in, sometimes they don't know like what reservation their people are from, but they find out because they hear the other kids introducing themselves. And pretty soon they can introduce themselves in their own tribal language. And, they themselves can hold a tobacco ceremony. They can sing the tobacco songs. They can sing the water songs. They come on the water walks with us. And this helps them to treat their body as though it's a sacred vessel. And, uh, we, yeah, we've seen this program work over the years. And so I thought I would just end with a little videotape. This is a, a musical that I wrote based on the um, Missouri Water Walk. And so there are Ikitawin Youth Theater folks in here. They're all the performers are water walkers, even the youth. And so it's just a little excerpt from the ending of that. So go ahead and let's play this. It looks like we have a problem with the sound, and I can't hear it. I don't know if anybody else can.
Here,
We can-
let's try this. We'll try it again.
We
Okay.
were able to hear it though.
Oh, you could?
Yeah, but maybe, I don't know if other folks could.
Try it again here.
This is a thing.
Oh, they can hear.
Well, um, maybe Lindsay can send it out to people, or I couldn't hear it.
Oh, I thought it was working that time.
Yeah.
Sorry about that.
Yeah. So I apologize for that. But this was, it was kind of a message to people. First people, Turtle Island, rise up, take care of what you've been given, honor the earth, honor the water, honor each other. And so that basically is a message. And in this performance, the youth would come at night, and when the walkers would in the play, when the walkers would rest for the evening, then the youth would come and they would sort of like protect the walkers. So it was really beautiful. This was performed down at Hidden Falls. But anyhow, it was just to give you a little example of, this is an intergenerational piece, but example of, what these youth can do. And we're working on a play right now about opioids, and we've been working on it for a while. But we'll do a reading this spring, I think in April or May, hopefully out at Shakopee. But then it'll be with the youth. But then we might cast again an intergenerational audience and have it performed in the fall. Um, uh, but it tells a story about a young woman, and born and raised here in South Minneapolis. So look forward to that, and we look forward to seeing you at one of our performances. We have a new building underway right now, and in that new building, we do have a black box theater, which will seat about 100 people. And the kids they will be the first theater, um, the first people of color theater in Minnesota to own their own theater. Um, and, they're also one of the oldest native theater companies in the country, going back to 1990, continuous theater. So we're very proud of that. And, storytelling is part of our culture, um, telling the stories of what's happening in the community. When we go to ceremonies for 4 days, um, there's no agenda. You go in and you participate in the ceremony, but by the end of those ceremonies, at the end of 4 days, um, what's important in the community emerges. And so everybody leaves going back to their respective states and communities and knowing what it is that we need to work on. And I think that's comes through, with, you know, participating in our ceremonies, participating in, these things that have kept us alive and strong, um, since time began. This is how we know what's important in our community. So there's a little bit of time left. I can try to answer questions if you have any.
Thank you, Sharon. I'm just gonna pull up the chat to see if we have any questions. Looks like Anna did say that we love hanging with the interns here at NAC, and that is very true. We just welcomed 2 new interns last week, so it's a great program.
One of those interns also, just to chime in, did end up participating in a diverse media campaign that we released some videos for, which was awesome. It was an awesome like continuation of her engagement with us here.
There is another comment. What are some ways urban Indigenous communities can build intertribal resilience and community to reduce opioid and other substance misuse?
Well, I think, there are so many and different tribes here in the Twin Cities. And I think we can, I've had the good fortune to be able to participate in ceremony with, people around the country, Stomp Dance in Oklahoma, Danza de Luna in Mexico, um, you know, um, um, and, whenever I go to ceremonies with other people, like, I know that I'm just a guest, and I need to be respectful and and um, and I think for folks who are coming here from other parts of the country, other tribes, I think it's the same. I think we do what we know how to do, and we invite them in. But that's not to say we're um, um, pushing any of our cultural ways. But I do believe like it's within our own cultures, within our own value systems, that we become healthy people. And, there's a book by a woman out of Canada. She's written a couple of books. One was Dancing on Turtles' Back, and another one was something like um, um, the way we've always done, something like that. Yeah, Leanne Simpson. And when she talks about, she says, in that book that there is a cultural resurgence across Indian country. And what she says, though, is that, this resurgence has to uh, we have to go back to like the creation story, right? So we go back to the creation story, we know that that's what informs us how to be in the world. So as she says in this resurgence of our cultures, we have to make sure that we are being respectful and inclusive of women, of the Two-Spirit population, of people with different abilities, and um, and and um, and did I say women? That's what we have. That's what we have to do, and um, we cannot create recreate anything or create anything that does not uphold everybody in our community. And I think that's if there's one thing that we could do, that would be it, is to be kind, to be honest, to be loving, to be generous, um, to have courage, and to really help people to practice those values. Linda, she's from Australia. She wrote that book about decolonizing research. Linda Smith, thank you, whoever is AG, thank you for coming up with these names for me. But, Linda Smith, she was here a few years ago, and she said, I could teach a whole semester on one of the values that make us who we are as Indigenous people. She said, I could teach a whole semester on kindness. And I think, like we sometimes say these are our values, these are our grandmother, grandfather teachings, and we sort of leave it at that. But how do we help people to practice these values? Because that's what makes us Indigenous. And if we all practice those values, and the values are similar amongst tribal people, the Lakota, Dakota, they have the same values as we do. They have one more, perseverance, perseverance. And so um, if we were able to teach, our young people through the stories, through practicing these teachings, um, everybody would be so busy doing the things that need to be done that there wouldn't be any time for getting into any kind of mischief, right? I also believe that art is so important. Art, whether it's and visual art, we have songs. We're doing a piece Saturday called Our Songs Have Power, and it's based on a song that's over 500 years old. We have another song, a morning song that was gifted to me and my sister, I don't know, 30 years ago. I don't know how old that song is, but it's ancient, and keeping these songs alive, teaching, and my grandson, he's a theater director, Kirby, and he's worked with the kids for 14 years. And, he said he was sitting in the circle about a year ago, and he had his head down, and they were doing the tobacco ceremony, and he was thinking to himself, if I should leave this program, um, who's gonna carry it on? Who's gonna carry it on? And so he was feeling kind of sad. And the kids finished going around the circle with their sema, and then they started singing the tobacco song. And sometimes it's just a couple of girls that sing, but he said he could hear. He had his eyes closed. He said, and his head was still down. He said, but I could hear, the young man sitting next to him, Michael singing, and his brother singing, and on the other side, some of the boys singing. And he said, and that was my answer. That was my answer. Who's going to take on this program when I leave? They are going to take it on. They are going to do the work. And I think, some of our kids in our program, they come in, their parents are in active addiction. Other people in our family are in active addiction. And we're able to get them to finish high school and to stay uh, sober and clean themselves and participate in cultural activities, not only with us, but with other programs. Some of them go to Indigenous Roots in St. Paul. Some of them go, to other programs as well. But the more active we keep them, active in the arts, you know, we teach them how to use their voice. Um, you can have the most brilliant, brilliant idea in the world. But if you say it and nobody can hear you, you know, kind of what good is it? So we have to teach them how to use their voice, teach them that they have a right to use their voice. We go to the lodge, anybody who wishes to speak can stand up, introduce himself, say what's on their mind. That's democracy. Anyhow, so um, any other questions?
Sharon, there's another great comment in the chat. Danielle said, the spirit of giving and generosity is so dear to our many cultures is what I'm hearing, and honoring diversity among and within our communities. That makes perfect sense. Thank you so much.
Yeah, I had a teacher at the university who said once that diversity, is essential to life. And he talked about an experiment they did where, there was a pond and it was clean and, and the water was drinkable. And so they did some experiments around that. They made a pond and they planted one plant in it. And after a while, you know, the water was brackish and you couldn't drink it. So they emptied out the water, they planted a couple other plants. It took longer, but it was still kind of brackish. And but when they planted that diverse plants in that water, it was healthy. And so diversity, you know, is essential to life. And I think, you know, we think about like, why did we grow Three Sisters Gardens? You know, because of corn, beans, and squash, they helped each other. They helped each other. They fed each other. The corn provided the stock for the beans to grow, and the squash provided some of the nutrients for the corn as well. So, you know, we can't grow things in isolation. You know, one young man was walking with me on a water walk, and he'd been with me for like, I don't know, 30 days, and we're down in Louisiana, and there was a ridge along the highway. And up on the ridge, you know, there are all these different trees, stand of trees. You know, there were pines and poplars and, you know, many different kinds of trees growing. And he looked at that and he had this epiphany, you know, and he said, look at all those trees just growing next to each other. You know, it was like this amazing idea, right? This so many. So anyhow, I'll stop there. Thank you so much.
Thank you so much, Sharon, for joining us today. It was great. And sorry about the sound on the video. I'll make sure to send that out to everybody to share that beautiful video. And then if anyone has any questions or wants any other resources, feel free to reach out to me. Thanks everyone for joining today. And I hope you have a great day and hope to see you on our next session, April 2nd. Thank you.